As Nicole said, my name is Tierney Payne. I am a licensed professional clinical counselor through the state of Ohio. I'm currently working at the North Center. Been there 2 years, but prior to that, I worked in Mansfield at a place called Family Life. I've been counseling since 2010 and working with children doing play therapy since 2013. When I first started doing the play therapy, my mindset was like, kids are just playing. Until I got to see what it was like and to understand what the therapist, their role is in the play. Yes, for the kids, they are just playing. But for the therapist and the parents, it's important for you to know like what the kids are learning in the play. So tonight, I hope that you'll learn what play therapy is, what age groups we're looking at when we talk about play therapy, and how does play therapy help with anxiety, how does it help with behavioral issues, okay? And then there's some, you guys had a handout that I came together working and doing this for a while and talking with other therapists. It talks about some things that you can help with children who are experiencing anxiety, and then also children who are experiencing behavioral things. I will also talk about some things that you can do with them as far as play. You just don't know the impact it has. It has lasting impact. One, they remember, they build memories, and they remember not what you bought them, but the time you spend with them. So as we go through, there will be a time for questions. I think we're going to do that towards the end. Yeah. So we'll get started. So what is play therapy? According to the Association of Play Therapy is the systematic use of a theoretical model to establish an interpersonal process wherein trained play therapists use the therapeutic powers of play to help clients prevent and resolve psychosocial difficulties and achieve optimal growth and development. That's, what are they saying? More simple. Play therapy is where licensed mental health professionals utilize play therapeutically to help your children process stressors, divorce, loss of family, symptoms, anger, anxiety in life by developing and implementing effective techniques to manage their lives. So what they're learning, they're thinking they're coming to play, and for them that's what they're supposed to do because that's what children do is play. That's their work. What we do as counselors is help them learn while they're in their playing. We help them to work through situations and circumstances that are causing them maybe stress, anxiety, depression, and there's different types of play, and as we go through, you'll learn that there are different types. There's 2 types that we'll talk about in particular. Plato says you can discover more about a person in an hour of play than in a year of conversation. Think about your experiences when you're little. How many of you guys played a lot when you were little? How many of you remember some of your experiences of playing when you were little? Right? Some of the good times, wasn't it? You felt relaxed, calm, right? When you become a dog, how many of us play as much as we used to? No, not many hands are raised. Play is important even as adults. So we need to make sure that we put time in for play for ourselves too. Okay? And as I said before, sitting with your child, playing on the floor, getting down to their level, speaking their language will help you to build that bond with them that will help where your child will be more apt to do things that you ask them to do than if you're sitting across the room yelling directives and not spending time with them. Play therapy is utilized with children who are experiencing behavioral problems such as anger management, grief and loss, divorce and abandonment, and crisis and trauma. Autism or pervasive developmental disorders, academic and social development, physical and learning disabilities, and also conduct disorders. As I said before, play therapy can be broken down into 2 types. Non-directive play. This type of therapy is led by the child. If the child doesn't want me to play, doesn't invite me in, then what I do is what is called tracking. I track their facial expressions, their body language, and their behaviors, and I say what I see. And what that does is it helps the child know that somebody's present with them, someone's paying attention to me, right? It helps them to learn the language of self-esteem. because I'm saying, you know, like the language of emotions, because I'm saying what I see. And one thing about children is if it's wrong, they'll tell you. They're really good about saying, no, that's not how I feel, or no, that's not what I'm doing, and they'll tell you what they're doing. Also, I track what they're saying, so I'll mimic back to them what they're saying to me. The first thing I say to the children is, this is your special time, and here you can say anything, you can do almost anything. If there's something you can't do, I'll let you know. The reason we do that is we want the child to feel free to try and say anything. The way they open up is if they feel like they can talk. They feel like they can do anything. Now, I said almost anything. The only time I'm going to set a limit with them is if they're going to hurt themselves, hurt me or anyone else that's in the room, or destroy any property. Okay? Other than that, the reason I do that is because I want them to feel free to roam around the room, to make choices, choose what they want to play with. If they want to invite me into their play, then they can. If they choose not to, that's their choice. Okay? So that's child-centered play therapy. Filial therapy is where the therapist teaches the parent how to do the child-centered play therapy. So they help them become familiar with the techniques of being in that role as a therapist. It's good for me to be there with your child, but it's even better for you to be involved with your child doing the play and helping them to work through the situations and circumstances, because you're the person that's with them more often than I am. So filial therapy is saying, okay, I'm teaching you how to play with your child therapeutically, okay, and also is helping you to build that bond with your child. Direct types of direct play therapy. Now there are other, like I said, there are other ones. These are just 4 of them that I picked out. Cognitive behavioral play therapy is directed by the counselor or the therapist, the clinician. What they do is they are looking at what are some of the behavioral things that the child is going through, and they try to come up with a solution. They utilize the play to help reiterate some of the skills and things that they'll go through. And as I said before, I'll show you some of the things that we utilize during this presentation to help children to get to their thoughts, help them to work through some of their emotions in a positive way. Some of the things that we help with emotional regulation, and also helping them to change behaviors. Theraplay is a type of play therapy that's more directed towards younger, is building a bond between the parent and the child. It is the therapist is teaching the parent or the caretaker how to play with the child. A lot of times you'll see theraplay with like younger, like infants, and also children who have had like trauma or even attachment disorders. Like they have difficulty attaching to people. Theraplay is helping them to, is a lot of hands-on, touching, looking eye to eye with one another. So it's helping to build that bond and that trust. So these are just some of the types of play therapy theories that they have and how they utilize it. Phases in play therapy. I think this is important for parents to know, is because sometimes, like I said, you think your child's just coming and they're playing, but if you understand what's going on in the sessions, it might help you to understand better, like, what is my child gaining from this? The initial phase or the early phase, what's going on at this time is establishing rapport and trust is being established for the between the therapist and the child, also between the child and the environment. Both the child and the therapist are learning about one another. The child is also learning the process of counseling and the expectations in counseling. That can take anywhere between 3 to 4 or 5 sessions, depending on the child. Resistance phase or acting out phase. This can be a difficult, scary, uncomfortable time for the child as they are trying to figure out, can I handle this? I don't know if anyone else in here has been in counseling as an adult, but it's not easy to come in counseling and sit and tell your story and what's going on. It's a process. And the same thing with children. It's a process. And sometimes you might get to a place where it seems like you're working things out, and then all of a sudden it's like, I don't want to do this. I don't know if I can handle it. And you want to stop. For children, Same thing. But sometimes what happens is they act out with their behaviors. So you might see where they're going along, they might fight and throw tantrums because I don't want to go, or they can be in a session and they throw a tantrum because they don't want to leave. Fighting with their parents, I don't want to go, I don't want to go. They might be in this phase. The child may act out behaviorally or emotionally at home or in session. Work phase. During this phase, the child is now in acceptance of the process of change. It is during this phase that the child is developing. A lot of times they have the basics, sad, mad, some of those. But then when I begin to say, I'm furious or I'm angry, just watching their facial expressions and helping them to understand that there's degrees of anger, they begin to pick that up. So helping them with that, helping them with their communication skills, just talking to them, they're getting your vocabulary, they're talking your vocabulary. If you talk to a child and you're talking to them baby talk, guess what? That's how they're going to talk. But if you're talking to them like people, guess what? They're going to begin to learn the language and talk to you. They learn emotional regulations. They learn how to identify, and then also learn how to control their emotions. Okay. And interacting with others. They have someone that they're learning how to share, take turns. Okay, very important things. A lot of times right now, we have an age of where cell phones and video games and our children's social skills are not developing. They spend a lot of times by themselves into the computer screen, and they don't know how to share with one another. They don't know how to even have a conversation. The termination phase. During this phase, the child is being prepared for terminating therapy. The therapist and the child process all the things that they've gone through and what they've learned throughout the session. This is a time where you ask the child, what some of the things that they've noticed about themselves. What are some of the things that they've grown from? A lot of times what happens is there's never this part. People will take their kids out of therapy for whatever reason, and the child never gets to say goodbye to that therapist. And what happens is the child will have a thought that, hey, they gave up on me, they abandoned me. They don't understand the reason why their parents stopped it, but it's important for them to learn how to transitions. Sometimes relationships don't always last. So being able to learn that process of being able to say bye to people, learning how to be able to say goodbye, learn how to express yourself, how they feel. One of the things I always ask children at this point is, how do you feel about counseling? How was counseling for you? How do you feel about counseling ending? A lot of kids will say to me, I'm sad about counseling ending because I really like coming here and spending time with you, but then they'll also say, I'm also happy because guess what? I get to go and I can do some other things, or I learned some things. Some of the older kids will say, I learned some things and I'm better, my behaviors are better now. I'm not getting into trouble as much as I was before. So it's important for them to be able to go through that. And each child who engages in play therapy, everyone that goes through play therapy will go through these stages. What does play do? Some of the things that you learn in play and why it's important when we do play therapy. It promotes social skills and positive relationships. Child learn to share and take turns. They learn the skill of negotiation. I think as adults, a lot of us don't even know how to negotiate. We want it our way. And guess what? Our children learn the same thing. They learn it from us. That I want things to go my way, so therefore the kids are learning the same thing. I want things to go my way, so they're not willing to negotiate. Compromise, same thing. Communicate. And they learn empathy for others. Promote self-awareness and self-control. Discover their strengths and their weaknesses. As the kids are playing, they learn some of the things that they like and enjoy to do. And they don't have somebody sitting there telling them, well, you like this, or do this. They get to make the choice of what they like to do and what they don't like to do. A lot of times, kids are being told what to do. I actually have parents who come and tell their kids, don't touch that, don't play with this, don't touch this, don't play that. It's okay, they're in the playroom. You want them to experience the playroom and be able to make choices and play with things. If you're always teaching your child, telling your child what to do, there's going to come a point when your child's not with you and they're going to look for their friends or someone else to tell them what to do because they never learned how to make a choice. choice is important. So they become aware of what they like and what they don't like. It helps them to be able to set boundaries and to respect boundaries and limits. Children learn to control their impulses through play. Children develop problem-solving skills, working. How many of you guys worked out puzzles before? Done puzzles before? How many of you watched children sit and try to work out a puzzle? Never done a puzzle before, but sitting there trying to work them together. You get to see like their frustration tolerance. You know, it could be. But one of the things I was talking about, like with child-centered play therapy, my job isn't to jump in and rescue them. My job is to sit there and help them to figure out. Now, one of the things I might say to them is, it looks like you're really becoming frustrated. It looks like you're not really understanding how these pieces fit together. You're not sure, you can ask for help. I will say that. I'm not telling them to ask for help. What I'm saying is I'm opening up the door. If they need help, they'll ask. And some of the kids will ask, but some of them won't ask because they want to try to figure it out on their own. And guess what? When they figure it out on their own, they are so proud of themselves because guess what? I got it. I worked it out. I have one little boy, when he first came in, he would be all over my office. And one of the things I would utilize to help him to learn how to calm himself was puzzles. So every time he would come in my office, I would sit him down and say, hey, let's try to figure out this puzzle. Now, was I doing non-direct or was I doing direct play? More direct. Having him sit down and work the puzzle. Every time he comes in now and he feels overwhelmed, the first thing he does, he goes in and gets a puzzle. And he goes to sit down, and he starts working at the puzzle. And sometimes he'll complete it, sometimes he doesn't. Sometimes he'll just get, after he finishes doing what he needs to do, he gets up, and then guess what? That's when we start the non-direct play. But he needed to be able to calm himself down because he was all over everywhere. So I utilized that to help him to learn how to calm himself down. And his mom has said it's helpful in some places where he goes to school, to daycare, because they have puzzles there. And so when he feels overwhelmed, he goes to get a puzzle, and he'll sit down and do a puzzle, and he seems very calm. So those are some things that you as parents can utilize to help your children. It's important to help your child to calm down, to learn how to calm down. They don't know how to shut down. They'll play all day if you let them, right? They'll run and jump and skip and everything. And some kids that struggle with like ADHD or maybe anxiety, it's hard for them to calm themselves down. Promotes emotional health. Children learn to identify and verbalize their emotions. They learn their triggers of their emotions. A lot of times, kids get frustrated or they get angry and they don't have the words because there's something that's bothering them, but they don't know how to say it. So they begin to identify, what is the thing that's bothering me? And then they're able to speak that out. Children learn positive coping skills to regulate their emotions, such as deep breathing exercises. And these are some of the things that as therapists, we teach children how to breathe. Because how many of you know that if you're not breathing correctly, oxygen's not getting to your brain and you're not going to think correctly, which means you're not going to make good decisions. So teaching you how to breathe the appropriate way so that oxygen is getting to your brain, and then being able to utilize that so that you can stop and think clearly and make good decisions. One of the things that we utilize, how many have used bubbles, played with bubbles before when you were little? And you can use this for anxiety, or you can use it for children who deal with anger, helping them learn how to deep breathe and calm themselves down. I always tell kids who deal with anger, if you're puffing and puffing, you're not going to be able to blow a bubble, right? See, when you're breathing correctly, you're going to breathe in through your nose, right? You're going to take like 3 or 4 count. You're going to hold it for like a minute, and then you're going to let it out of your mouth slowly, right? So when you do it, when you breathe, your stomach should go out, right? Out. And then when you're breathing out, your stomach should go in. So I'm going to demonstrate it first. So you go, watch my stomach, watch my hand. And we practice that in the children, right? When you're blowing a bubble, what do you need? You need the air, right? So in order for us to get a big bubble, we need to take in a lot of air. And little kids really like this because they like blowing bubbles. So we take it in, we take the big breath in. And then we let it out slow. Try it again. And we try to get them to blow a stream of bubbles because the consistency of the letting the air out. And I also help them when we do the bubbles in the, or we're doing the deep breathing. I help them before they start. We talk about like, how do you feel in your body? You know, are you feeling tight in your body? You know, are you feeling, like, where are you feeling some of the pain? Because we feel our emotions in our body. A relaxation, like a lot of kids will say, I feel like my shoulders are feeling going down or something like that. I feel calm. And that's how it should be. They shouldn't still feel tight or tense. If they're still feeling that way, then you keep practicing with them. But once again, you breathe in through your nose and then out through your, hold it for a minute and then breathe back out through your mouth slowly. So you go. I want you guys to practice it with me. Guys, perhaps you are going to get away with it, huh? How can you teach your children or help your children to practice it if you don't try it yourself? So I want you to put your hands on your stomach. All right? We're going to breathe in through our nose. So I'm going to say it, and I want you guys to do it while I'm saying, okay? So you're going to breathe in through your nose. Okay? Ready? Go. Breathe. Exhale. Slowly. Anybody feeling any different? Or we're just too shy to say? They learn the language of their emotions, and they learn verbal and nonverbal forms of communication. They begin to recognize, like, your facial expressions. They begin to hear your tone of voice and understand the difference. One of the things I like about some parents, I notice, like, when they are trying to tell their children, give them a directive, you hear the parents say their first and middle name. It helps them to learn, it helps the children to understand, when I say just your first name, they're usually playing with them. But if I'm saying your first and middle name, it means I'm serious. There's something I want you to hear and listen to. So I do take that and encourage parents to utilize that to help the children to differentiate, I can't say the word, to understand the difference. Promotes physical health. They learn balance, coordination, and flexibility in their play. They use their large motor skills, jumping, playing, running, and hopping, all those large motor skills. If you're sitting down all day in a chair playing a video game, the only muscles that you're working out are what? Your thumbs, right? That's not helping the kids. And then they end up, as they grow older, with pains and aches because they're not working these. And they don't have gym and stuff and recess like they used to. It's being taken out, budget cuts and everything like that. It's important for us as parents and as adults to support those and encourage that the schools provide those, because that is an outlet for your children to get people who are dealing with anxiety, children who are dealing with ADHD, they need to be moving and stuff like that, and that helps them. Children develop fine motor skills through writing, drawing, coloring, and painting. It also helps to create their creativity with the drawing and writing and coloring and painting. Common symptoms of children with anxiety: excessive worry or fear, is the ability to control their worry or fear, difficulty with focus and concentration, irritability, and sleep disturbance, and fatigue. With the focus and concentration, well, a lot of times with anxiety, you have to be careful because sometimes they can mimic ADHD. Some of the same kind of behaviors you'll find in ADHD children, and a lot of kids will be diagnosed with ADHD, but they may be experiencing anxiety. Somatic complaints: stomach aches, headaches, some of the behavioral concerns in children. Not listening and following directions. Temper tantrums, falling on the ground, refusing to do what is asked. I'm not even moving. I just guess I'm breathing. Anger and aggression, hitting, kicking, biting, breaking, and destroying things. And difficulty with focus and concentration, and not respecting others' boundaries. How does play therapy help to decrease some of this? A child learns to identify and express his or her worries and fears in the presence of a caring adult. They receive empathy. Their feelings are validated. I might not agree with their feelings, but I still validate their feelings. How you feel is how you feel. What you think, what you think. Those are your thoughts and those are your feelings. I can't tell you you don't feel that way. How many of you have heard seen a child fall down and they're crying, the parent says, oh, stop crying, that doesn't hurt. It might not hurt you, but that child's hurt. It could be their pride is hurt, their legs are hurt, whatever. If I say, oh, it looks like you're really hurting yourself, you really don't feel well, or it really hurts your leg, guess what? That child is able to say, yes, I feel this way, and it's okay for me to feel this way. But when their feelings are dismissed, what does it lead to? Anger, resentment, depression. Nobody cares. Focus and concentration are increased when a child has developed and is utilizing positive coping skills that they have gained through their play. Part of the problem that the child is having is they feel like they have no control in their environment. And what they do, they act out. Now, you are the parent. I'm not saying give complete control to your child. Giving choices to your children helps them to have some power. Because if I say, you can, or would you like to have milk, or would you like to have juice? Who has the power? The child does. Instead of me saying, here's some milk for you. Sleep disturbance and fatigue are lessened as the child learns to relax and resolve his or her own fears and worries. And somatic complaints, stomach aches, headaches decrease or lessen as the child begins to have better control over their fears and worries. Because a lot of times the stomach aches and headaches are because I'm worried, so then they begin to get the somatic complaints. Once they're able to control their fears and approach their fears, then that decreases because now I'm not fearful anymore. I've learned to have control over it, or I've learned how to approach the situation. With anxiety, it's very important to teach your child how to approach the situation. You do it in steps, but one of the things about anxiety, it is a fear-based disorder. So anything that I'm worried about or anything that I'm scared of, what do I want to do? I want to run. I want to go away from it. I don't want to deal with it because I'm too afraid, or it just keeps going on my mind and I can't get it off my mind, so it makes me upset and worried. If I avoid it, then what happens is I never approach it. So then I don't gain the confidence enough to say, hey, I can do this. So one of the things on your paper that talks about things that parents can do is help your child learn how to face their fears. Acknowledge and recognize their feelings about it, but then help them come up with a plan. Children learn to listen and follow directions when they feel that they are valued and cared for. Play therapy provides an environment where children feel valued and respected, and in turn, they respect and value you and are more willing to do what you ask. How many of you, as adults, if someone's not being respectful to you, are you willing to do what they want you to do? So what makes you think children are going to be any different? Right? You want to be respected and valued. Yes, you are the parent, you're the adult. They know that. They want to know that they're still valued and that they're respected. Respecting them, validating their feelings helps them to feel that. Temper tantrums decrease as children learn to understand limits and develop self-control. In their play, as I said, when a child is they're playing, and if they're going to hurt someone or they're going to damage their property or anything like that, then I'm going to set the limit. But one of the things I have to do, I say something to them about setting a limit, I have to follow through with it. For instance, if I have a child who's throwing a ball and they're playing with the ball in the room and they throw the ball against the screen, my computer screen, I'm going to say to them, hey, remember I said if there's something you can't do, I'll let you know. The ball cannot hit the computer screen. Playing with it softly, because guess what? They're trying to control it because they want to keep playing with it. So say it hits again. And I say, remember I said if the ball the ball cannot hit the computer screen. If the ball hits the computer screen again, then we're going to have to take the ball away. We won't play with it the rest of the day. What am I doing? I'm giving them another opportunity to try to control their behaviors and to make a decision. Some will pull it down and some will not. Sometimes you'll have a child who intentionally is trying, and you'll say to them, I know you want to throw that there, but you cannot do that. And if you do that, then we're going to end the session. Right? But what I'm doing, I'm telling them, giving them an opportunity to make a choice, and if they make a good choice, then what do? We keep playing. But if they make if they choose a bad choice, then what I said was going to happen has to happen. Why do I do that? Because they need to know that I'm being truthful with them. They need to be able to trust me. So if I say I'm going to do something, whether it's positive, or if I say I'm going to do something, whether it's negative, I need to follow through. A lot of times, especially for children that have behavioral problems, a lot of times you can see, has there been, look at yourself and say, have I been consistent? Have I said one thing and did another? Have I let it slide because, oh, today they were being good, really good all day, and I really don't want to take it from them. And then next day, maybe I'm not feeling good, and they do the same thing, and now I'm yelling and screaming at them, taking it from them. That's inconsistent, and it doesn't help them to learn the limits and develop self-control. Anger and aggression decrease as children learn positive coping skills, coping and social skills to manage and express their thoughts and feelings. Children learn to set and respect others' boundaries as he or she develop positive social skills and begin to understand where they and others begin and end. Some children don't understand that I can't just come up and touch on you. I need to ask permission. I've seen children who, complete strangers, just run up to them and start hugging on them. And where they end, they learn the boundaries. They learn the social, the facial expressions that says, hey, if I'm doing like this, what's that mean? Don't come here. Some kids don't understand that. They don't recognize that. But as they're playing and they learn, and the more it happens, they begin to recognize, oh, that means stop. Practical things you can do as parents, and you have the flyers here. There's one for helping the children who suffers with anxiety. So these are some things that parents can do. And then the other one is about behaviors. Be calm. When you are calm, it helps your child to relax. If I'm yelling and screaming at you, first of all, you're listening to me. How many of you like people that yell and scream at them? I didn't see nobody's hands raised. What happens when people yell and scream at you? You tune them out, don't you? Kids do the same thing. So if I'm calm, one of the things it does, it also helps them to calm down. It helps them to see, I can be relaxed. I don't have to be anxious. But if I'm a person that deals with anxiety, and you will see this a lot of times with parents who deal with anxiety, and they haven't been working on it and to control it. A lot of times, if they have children, their children will be anxious because their parents are anxious. Oh, don't do this, don't touch that, don't do this. Or they're worrying all the time. And the children learn that because guess what? Kids learn from what you do, more so than from what you say. You want to make sure that you, if you know where you're going, you want to kind of prepare your children, tell them, we're going to go here. You want to try to give them an explanation of what you are expecting from them as their behaviors. Okay, we're going to go to the store. When we go to the store, Mommy doesn't have any money, so I don't want you to ask for anything, okay? If you don't ask for anything while we're in the store, then when we leave, Mommy will make sure that you get something to treat at home, right? Because we're going to get these few things. So we go in the store, you might have them asking, what do? You remember what Mommy said. Mommy said, Mommy doesn't have any money, don't ask any questions. If you don't have, when we get home, then Mom will give you something as a treat, right? Preparing them is important because how many of you, if you don't know where you're going or if you don't know what to expect, get kind of nervous, right? If you know where you're going or what's going to happen, kind of know what's going to happen, it makes you feel more at ease, right? Same thing with our children. Learn the coping skills that your child is being taught in counseling and help them practice them, such as deep breathing or muscle relaxation techniques. Different skills that your child is learning, learn them so that you can help them practice them. It is a proven fact that children who learn them and practice them outside of session tend to do better with reducing anxiety and depression, behavioral issues, because they're doing what? They're learning the behaviors. They're not just learning it for a minute and then going back out and not learning it and then practicing it. Practice it says what? Practice makes perfect. Do not help your children avoid things because of their anxiety. We talked about that. Help them to gently help them learn how to approach it. Like I said, it helps with problem solving. When you help your children come up with how to overcome something, one of the things that happens is, one, they take part, they really get interested because now it's part of my idea. It's not my mom telling me how to do it. I'm taking an active role in planning this. And then two, it helps them when they achieve it. It helps to build their self-esteem because guess what? I was able to do this. I'm able to work through this. Now I can do it again. Educate yourself on anxiety and seek professional help when needed for your children. Be sure to keep a record of signs and symptoms, and this is very helpful, especially if you're first starting counseling, or also keeping a record, like say you have anxiety when they first come in the door, is that a 10? Knowing the signs and symptoms and when it's occurring, how long it's been going on, has it been going on for a year, has it been going on for a month? Those things are all important because it helps us to diagnose, is it anxiety? Or is it normal anxiety, or is it anxiety that's a problem? So knowing those things and helping to write that stuff down is helpful, but it also helps with ongoing treatment because if I come in with a 10, feeling anxious at a 10, and I'm still feeling 10 when treatment's supposed to be ending, there's no progress. But if I started at a 10 and then from week to week and I'm showing that there's progress, now it might go back up, but it should go back down. By the end of counseling, it should be down where the child is able to manage it. Helping the child who has behavioral problems, give clear expectations. When you are clear with your expectations, it helps your child know what you are expecting and they are able to follow through. Be sure to spell out in simple terms your expectations. For example, don't say clean your room. Actually say I want your room to be clean. That means I want your dirty clothes in the dirty clothes laundry. I want your toys in your toy box. I want your bed made. Now remember, they're not going to make a bed like you make a bed. You have to look at your child's developmental age, where they're at. And I'm not talking about their chronological age, because some kids might be 7, 8 years old, but they are only maybe developmentally maybe be at 5. So you want to make sure that that's there. Be prepared. Many times kids have temper tantrums or meltdowns when they're hungry, tired, not feeling well, or bored. Take a bag with you. Model the behavior you want to see. Kids do more of what you do than what you say. Provide choices and be consistent. Any questions?